This is PediaCast.
Welcome to PediaCast, a pediatric podcast for parents. And now, direct from the campus of Nationwide Children's, here is your host, Dr. Mike.
Hello, everyone, and welcome once again to PediaCast. It is a pediatric podcast for moms and dads. This is Dr. Mike coming to you from the campus of Nationwide Children's Hospital. We're in Columbus, Ohio. It's episode 530 for January 31st, 2023. We're calling this one Talking with Children and Teens About Death and Dying. I want to welcome all of you to the program. So there are not very many things in life that are certain, but death and dying is one of them. Every human that has walked the earth before us has died, and each one of us will die, our children will die, and all of our family, friends, and loved ones, all of them will pass away. It's inevitable for all of us, which should make this topic super easy to talk about, right? I mean, it's something all of us share, regardless of our age, our ethnicity, our country, our education, our income. So it makes sense that curiosity and conversation would at times center around this shared experience that we are all marching toward. And yet it is not easy to consider or talk about for most of us, because while it is a shared experience, there is also a sadness and pain. There is grief over loved ones dying, and there are lots of difficult questions to ponder and discuss, like what does it all mean, and where are we headed, if anywhere? So in reality, death and dying are difficult topics for adults to talk about with one another, and it's doubly difficult to talk about death and dying with children and teenagers. And yet, these are important conversations, especially as kids experience the deaths of grandparents, extended family members, friends, sometimes a parent or a sibling. Where does one begin? What words and concepts should we use? Do we attempt to shield our kids about the reality of death, or do we talk straight and share our own, sometimes troubled thoughts with them? So these are great questions, and it's important to think about these conversations before our children are actually impacted by the death of someone they love. The difficulty is compounded as we consider a child's age and developmental level. You know, we'll talk about death and dying with a preschooler in a very different fashion than we'll talk about death and dying with a teenager. So we're going to cover all of the age groups today, including infants and toddlers, because they are impacted. Preschool kids, school-age kids, we're going to divide them up to the 5 to 9-year-olds and then the 9 to 12-year-olds. And then we'll talk about teenagers. And we're going to explore each age group's views and understanding of death, useful language and concepts that we can share as we support grieving children, expected behaviors from our kids in response to death at all of these age levels. And then we'll talk about helping our kids cope with their feelings and the reality of a loved one's passing, and how to build a legacy and not forget those who have shaped our lives. So lots to cover today, and we have three terrific guests traveling on this journey with us. Karen Roberts and Ashley Pelino, they are both clinical social workers at Nationwide Children's Hospital, and Dr. Megan Schaefer is a psychologist at our hospital. All three of them work with our palliative care and hospice programs and have lots of practical experience talking with children and teens about death and dying. Before we get to them, let's cover our usual quick reminders. I know they're a little boring to hear over and over, but they are very important and really help the podcast a lot. First, you can find us wherever podcasts are found. We're in the Apple and Google podcast apps, iHeartRadio, Spotify, SoundCloud, Amazon Music, and most other podcast apps for iOS and Android. If you like what you hear, please remember to subscribe to our show so you don't miss an episode. Reviews are also helpful. Please consider leaving one of those wherever you listen to podcasts so that others who come along looking for evidence-based child health and parenting information will know what to expect. We're also on social media. We love connecting with you there. You'll find us on Facebook, Twitter, LinkedIn, and Instagram. Simply search for PediaCast. And we have that contact link over at PediaCast.org if you would like to suggest a future topic for the program. Also, want to remind you the information presented in every episode of our podcast is for general educational purposes only. We do not diagnose medical conditions or formulate treatment plans for specific individuals. If you have a concern about your child's health, be sure to call your healthcare provider. Also, your use of this audio program is subject to the PediaCast Terms of Use Agreement, which you can find at PediaCast.org. So let's take a quick break. We'll get our expert guests connected to the studio, and then we will be back to explore talking with children and teens about death and dying. It's coming up right after this. Karen Roberts and Ashley Pelino are clinical social workers with home-based hospice and palliative care at Nationwide Children's Hospital. Dr. Megan Schaefer is a psychologist at Nationwide Children's and an assistant professor of pediatrics at The Ohio State University College of Medicine. All three have a passion for helping children, teenagers, and families impacted by death and grief. That's what they're here to talk about today as we explore talking with children and teens about death and dying. But first, let's give a warm PediaCast welcome to our guests, Karen Roberts, Ashley Pelino, and Dr. Megan Schaefer. Thank you all so much for stopping by today.
Thanks so much for having us. Happy to be here.
Yeah, thank you so much.
We're really looking forward to talking about this today with you all.
Yeah, I really appreciate you guys stopping by and taking time out of your very busy schedules to be with us. We're going to break our conversation into several age groups today because the way in which children and teens understand and relate to death and the words and concepts that we use to communicate with them about these topics, these words and concepts are going to be very different depending on the child's age. So we're going to consider separately infants and toddlers, preschool kids, and then we'll break school-age children into 5 to 9-year-olds and 9 to 12-year-olds, and then we'll wrap up by talking about teenagers. So first up is going to be infants and toddlers. And Karen, I want to start with you. Infants and toddlers, as we think about them, sort of the family being impacted by death and grief, what does this age group really know about death? Probably not much, right?
Absolutely. They don't really have a concept or understanding of death, but how they do experience it is through the changes that they have in their lives. So they're really bonded to their caregivers, and so they pick up on those kind of cues from their caregivers. So they might notice, grandma's putting me to bed tonight, or they might pick up, particularly the older ones, on going to bed a little later and having a different evening routine.
Yeah. And Ashley, then how do they respond to these changes in their routine? Because that can be sort of not only disruptive for them, but then the behaviors that they respond to the change may be disruptive to the family, right?
Yeah, absolutely. I mean, they're going to recognize, it's more of like they're having a sense of changes in the household. They may sense more activity, less activity. So they are going to respond in a high anxiety or high stress situation. They're also going to have that same high stress and high anxiety. And for infants, especially, they can't tell us that they're feeling that. So that's going to come across as fussy or just feeling out of sorts.
Yeah. That almost seems like a feedback loop, right? Because, when kids are fussy and crying and maybe more demanding and need more attention at this time when, as the parent, you may be dealing with grief yourself, that just makes things worse, right?
Absolutely.
So then, how can we break that cycle? How can parents, Megan, help their kids, even that young, maybe deal with this a little bit better?
I think the most important thing for infants and toddlers is keeping their routines consistent. So oftentimes when things aren't consistent, that is really what they're going to pick up on, those altered forms of care. And this helps them feel secure. So when we think about their bedtime routine or eating or snack time, all of those things we do day to day, that is what really makes them feel comfortable. Other things we consider are things to help them feel more relaxed. So when we're speaking with them, speaking in a calm and soothing tone or singing songs, little kids are really good at picking up stress in the home. And as you mentioned before, a lot of other people in the home are also likely experiencing grief. So ways that we can present to them in a more calm and relaxed manner can also help them cope.
Yeah. I caught myself. I said, how can we help these kids deal with it better? As in, that kind of makes it seem like there's a right way and a wrong way, but we all deal with, as we'll find out, and we go through these age groups, we really all kind of understand and deal with death and grief a little bit different, right? There's not necessarily a right and a wrong.
No,
Correct.
There's no pathway.
Absolutely.
Yeah. I mean, everybody has their own past experiences that they're building on, and then that context goes into how we deal with current situations and all those things. Karen, one of the things that we're going to talk about with each of these age groups is ways that we can build a legacy around those who maybe have passed and we've lost. So there's grief, yes, but that remembrance and legacy building is also important. What can we do in the infant and toddler ages to help build legacy for their connection to the person that's passed moving forward?
Well, they can start young with helping with the memory boxes full of items that are special, and like family photos are huge in this. But let's say their sibling loved baseball. They could put the favorite baseball in a memory box, and then you can share stories about it as you're doing that. My sister loved to cook, so we've got her little chef's hat. We're going to put that in the memory box. And again, during that time, it gives them an opportunity to talk. Granted, these are little guys, but then these are things that through the years they can continue to access and go back to.
Yeah, they may not even remember the chef's hat going into the box, but then in years to come, as you remember and maybe bring it back out and talk about it, that way that lost sibling may be really a part of the family, even as this child who may never remember knowing this sibling can really be a part of their growing up and a part of their life, even though they're not with us anymore.
Exactly.
Yeah, it seems like such an important thing. Okay, so not a lot to say about infants and toddlers. Just to kind of sum up, they're going to notice changes in daily routines. They're going to respond to those changes, and so anything that we can do, despite our grief and dealing with this, to try to keep their routines as normal as possible in order to prevent further disruption of the family unit. Let's move on to the preschool years. So now we're talking like 3-year-olds through 5-year-olds. So Ashley, how does this age group then view and understand death?
So this is a very concrete age, right? We're here and we're not here. I always help walk parents through this when I talk about, us as adults. Sometimes we use flowery language like passed on or left us. And so children really benefit from more of a direct communication about somebody has died or it can feel a bit jarring for adults to use such direct language with children, but actually it's how best they understand.
Yeah. When someone, as you said, if you say like someone passed away or someone left us, that may be that they went to another state, and then there's the possibility that they're going to come back.
How do you more comfortable for us as adults to say that, but it's confusing for this age group because they're so concrete.
Yes. Yeah, that makes sense. How do you explain that then? Like, where did they go? I think that's going to then become a persistent question because preschoolers don't give up their line of questioning. So, how do you respond to where they went? Yeah.
And some of that is a family discussion and decision. Some of that may be based off your faith. That is sort of how you decide in your family, where do they go? Depending on your culture or your faith, they may be in the ground, they may be in heaven, they may be with grandma. There's different ways you can kind of process that through depending on what your family culture or family tradition is.
Yeah. And that might be something to think about even before you encounter this situation. So not that you want, a prepped answer completely, but at least start thinking about what you're going to tell your kids about death when the situation comes up. Might be easier to do when you're not stressed.
Absolutely.
And then, Megan, what are some helpful words and, descriptions that we can use that's at their developmental level that would be helpful for our 3 to 5-year-olds as we talk about death and dying with them?
Yes, I think this is a great question and comes up a lot in all of our clinical work because these are really scary conversations for caregivers to have. As we were talking about before, using that direct, honest, and clear language is really important because when we're not using that language, it often causes more worry. I always say when kids do not get all of the answers, what they think about in their heads tends to be even scarier than what is actually going on. And so we really want to be direct with them. And so often the way I describe this to our preschoolers is talking about using those very direct languages like die, death, but then also talking about what that means, which is essentially that the body stops working. So we might talk about things like grandma can no longer eat, or she may no longer move, or not being able to cuddle with you. She's not going to be sleeping anymore. Those types of direct behaviors that kids can really grasp onto can help them understand what it actually means to die. And we also can talk about things like saying, we will miss her because she won't be here anymore. And that keeps reinforcing that very concrete information about what it means to die. At this age group, kids will often ask questions such as, is death like going to sleep? Are they going to be hungry? Will they be cold? Did I do something that would cause the death? So I think that's something really important we want to keep in mind when we're talking to kids about somebody dying in their family, letting them know that there's nothing they did to cause the death. Oftentimes these kids might say, I was really mean to brother. That must have been why he died. And so really emphasizing that I think can be helpful overall with coping. And then what I also always tell parents, it's okay if you don't have all of the answers. A lot of us don't know everything when it comes to death and dying. And so if a child asks a question that we don't know, it's okay to say, that's a great question. What do you think? And it allows them to kind of share their own belief systems and help guide them, but letting them know we don't know all of the answers as well.
Yeah. And just answering as honestly as you can with words that they'll understand.
Yes.
It's kind of a developmentally appropriate way. A recurrent theme on PediaCast through the years has just been how important it is to have open lines of non-judgmental communication among family members, and especially between parents and their children. And we've always said that that's easier to do in the teenage years when you start having those conversations when they're preschoolers. And this is just one example of where rather than just kind of brush it under the rug, like really talk about feelings and open up in a way, being vulnerable and transparent with our kids right at this fairly young age. But that encourages those kind of conversations then throughout their childhood and into their teenage years too, right? And that can be a great benefit.
Yes. And I think as you're saying, like building that trust, right? Sometimes kids will try to protect their families from feeling some of these difficult emotions. But if we're opening those lines of communication, kids know they can always reach out, even if it's talking about things that are very difficult and scary.
Yeah. Now, for the younger kids, we talked about behaviors in response to death and dying that's impacting the family, and that may just be that they're more fussy and irritable and upset. During the preschool years now, we have more verbal kids that can tell us what's going on in their brains. So what kind of behaviors would we be expected to see as a result of this emotional energy that's in the house right now?
Well, I always think in terms of this age group regression, because it's so much, pee and poop at this stage, So it's like that's what they have control of. And so we tend to see some regression in this area. So they might have been totally potty trained. They're starting to have accidents. Same thing overnight. They might have some of those accidents. So that is normal. They also might be more resistant at bedtime. Us as adults, we tend to, when your body slows down for the day, that's when those thoughts creep into our heads. Same thing with kids. They know things are going to slow down. So they might be doing all kinds of things to avoid bedtime, to maybe even stay connected to that parent for a little longer. They might be afraid of dreams or things that come up at night. So that's where, again, when we talk about consistency routine, that's always helpful for this age. They might ask questions over and over again, just to make sure that you give them a consistent answer. And they might ask that to different people in the family.
Oh, that's smart.
Yeah. They're persistent.
Yeah.
And then there's also total normal behavior with kids where they're okay. They seem fine. I remember being present with a family that really incorporated their younger kids while their daughter was dying, actively dying. And I was at the home all through the night, and we were waiting for the funeral home, and I had a 4-year-old boy, and we were coloring together. And as we were coloring, he was just playing with his toys, talking about, and in the middle of it, he just said, sister died, right? And I said, yes, she did. And then he just kept on going and coloring and then playing.
That really, you talk about regression and versus just kind of going on with normalcy. I could see both of those things sort of being upsetting to parents if you don't anticipate that that's what the reaction is going to be. So on the one hand, when kids are regressing and sort of acting younger, from a parent's point of view, it could be like, I don't need this right now. But when you understand why they're doing it, maybe you have more patience for it and more understanding. But likewise, it can also be, what, aren't you upset about this? From the parent's point of view, like, don't you care that Sissy died? How can you just color normally? But when we understand that that's their developmental level and that's what we can expect, I guess it's easier to take.
It is. And just like Megan was saying with the trust and encouraging communication, in the morning when they wake up and they've had an accident, that gives parents a perfect time to say, it's okay, it's normal to have, and then start processing those emotions. I think everybody wants to be like, oh gosh, we got to send our child to somebody to talk about this, when I always say the best resources are right there in the home. If you feel able to encourage that communication and discussion. But those are who the kids are going to go to.
Yeah, absolutely. And that actually leads us very nicely into the next point. And that is, how do we talk to these kids and really help them cope with death?
Yeah, absolutely. I always tell parents too, like, it's okay for your children to see you have emotion, right? I think a lot of times we see parents who worry that if they're sad in front of their other children, or they're having strong emotions, grief, anxiety, worry, that's going to scare their child. And like Megan mentioned earlier, being left alone with their own emotions and not seeing examples of coping with that is really even more scary often for children. So we encourage, crying in front of your children, emoting in front of your children, letting the child see how you work through this difficult thing, because unfortunately they're going to face grief throughout their life as well. And seeing an adult model how you navigate these tough emotions is a great way for them to see how they're going to be able to cope with that as well. Yeah.
Do you, in your opinion, is it helpful then for them to even like go to the funeral and really be a part of the entire process?
Absolutely. I mean, it's up to the parents ultimately, of course, and what they feel like is appropriate and what they feel like their child can handle. But we would always encourage children to attend a funeral if they feel like it's appropriate. Yeah. Absolutely.
Yeah, even at the preschool age.
Yeah.
Absolutely. And then, Megan, we've talked about legacy building. For this age group, the preschoolers, 3 to 5-year-olds, because now they can really participate in this legacy building activity, right? What are some great things for preschoolers?
Yes, I think Karen gave us a lot of great ideas for preschoolers and thinking, or in infants and toddlers. And I think going forward, a lot of these will apply across all developmental stages. At the preschool years, I think other things that I might consider is, when we're having them that continuing bond. So maybe it's like a picture of grandpa on your nightstand and you're actually having conversations with him, or you give him a kiss every night before you go to bed. Or I feel like there's a lot of just wonderful like crafting opportunities to have special mementos that you keep with you. So I see a lot at this age, maybe it's taking a shirt of somebody who had died and you make a teddy bear out of it, or you have a quilt of clothes that they had. And it's ways, I think, especially as we're thinking about ways to keep these younger kids more comforted at night. It's a teddy bear that they're holding or a quilt that they go to sleep with. But I think kind of in this age for kids, having something that they carry with them that was a part of the person that they loved can just be really valuable and helpful as they go through their day to day.
Yeah, absolutely. Let's move on to school-age kids, and we're going to kind of divide them up into 5 to 9-year-olds and then more the middle school kids after that. So Karen, how do kids 5 to 9-year-olds, kids who are 5 to 9 years of age, how do they view and understand death?
Well, they are very protective of other people when they see them sad. It's interesting. My son was a toddler when my dad died, but continuing in this age, whenever he would see me cry or get upset, he would put his hand on my shoulder and say, "Are you sad because Papa died?" They really kind of, associate those feelings with that, and they can be protective of others. They also see that death is a possibility, but then at the same time, they also feel like they're invincible, kind of that superhero, live forever kind of thing too. So it's a dichotomy there. Another thing is some death anxiety, kind of worrying about other people and them dying and leaving them too. So a lot of, reassurance is good to help with them. So they really want more of those concrete answers and information that we've talked about before with direct communication. So they seek that. But then they also, at the same time, can have a strong fantasy life too about their lives before the person had died. So all those things are a little normal. And then there's also just they might run away from the feelings of pain and sadness. We know as adults kind of the only way out of your way is through your pain, but they're still trying to convince themselves that if they do something to hide it, it'll go away.
Yeah, absolutely. A lot of these kids, then even long after maybe the event that's impacting the family, continue to sort of have a death fixation and ask about it over and over and over again. Is that normal? Oh, yes, totally normal. Certainly if somebody else they know is sick and it's a sickness that's similar to their loved one. Yeah. My daughter, when she was this age, she kept asking about death and dying, and she wanted to know when she was going to die. And, you try to answer in an appropriate way, but sometimes then your fuse just runs short. And I remember telling her, okay, you're going to be really, really old before you die. I mean, of course, I can't promise that, but you just snap at some point, Yeah. And she said, but Mommy's really, really old and she's not dead yet. And of course, my wife's in the car. That was lovely.
Nothing like kids to
that was a
always
fail.
Bring some honesty to.
Yes, yeah, exactly.
And levity.
So that was not the appropriate way to talk about death and dying to my daughter. But
I think it goes to show we don't always have the answers, and I think something we can really offer, I hope, parents through this discussion too, is we don't even have all the answers. You do what you can to identify what your child needs in that moment, and take the lead from them, answer the questions that they have, and kind of leave it at that. You don't feel like you need to give, a dissertation on death and dying to your 6-year-old. They say grandma died, or grandma's, body stopped working, or sister died. Yes, sister died. Do you have questions, or what are your thoughts on that? And then if they leave it there, they leave it there. We don't need to, kind of over process and over emote with them. And again, this age group, I think, is really important to offer a lot of reassurance to, because they are starting to understand the finality of death and may have questions about their own death, or their parents' death, or other people's death, exactly like what you said with the fixation. So answering the question they have in an age-appropriate way, and then if then they're back to coloring or moving on, then you're rolling with the next emotion there too. Yeah.
Just really responding in the way that they need you to respond in that moment. And it may be a roller coaster for a while.
Absolutely.
With that. And then in response to this sort of crisis in the family, what kind of behaviors do we expect out of our younger school-age kids, 5 to 9, Megan?
So I think from the emotional standpoint, typical emotions that we would expect would be anger, frustration, sadness, distress, anxiety. And we'll see that across development, that we would expect those emotions will come up with grief. I think one thing that's important to mention at this age, as we said, they're school-age children, right? So they're going to school. So we need to start thinking about what those behaviors look like there so we can be most supportive in that setting. So oftentimes kids who are grieving, we might see more forgetfulness. There might be more acting out at school. And usually I explain that to parents of kids start acting out when they feel like they're losing control. And so something happened in their world that no longer made sense. And so they're trying to find ways where they can get that control back. And I think that helps parents understand, as we mentioned before, it can be really frustrating when the whole family is grieving and all of a sudden the principal is calling all the time saying the kid is getting in fights or they're not paying attention attention in school. And so in that way, again, that helps us know how we can best support the child moving forward. Also, as we've talked about, I think like increased nightmares, sleep difficulties can be really common. And then at this younger age of school age children is some new like fears or phobia. So for example, they might have worries about going to sleep, or if they get the cold and someone died of cancer and we use the word that they were just sick, they might start to associate, well, you said I'm sick with a cold. Does that mean I'm going to die? And so again, I think that's really important. We haven't necessarily hit on that of the reasons why people die, but that's also really important to have very clear language, because if we use something vague like sick, getting a cold versus having cancer can mean very different things. And so I think we want to be able to support them in that way. Also at this age, we might just see a little bit more like physical complaints, so like stomach aches and headaches that come from emotional distress. And you could also see how that could cause more worry when you start to notice physical changes in your body. And again, that's kind of helping kids understand what stress can do and what kind of coping strategies as they get older can be helpful for addressing more of those physical symptoms.
Yeah. You mentioned behaviors at school. Is it a good idea to inform the school that this is going on in your family preemptively, even before there are any behavioral problems, just so that the school can kind of be on board and know what's happening?
Yes, I think that is a really great recommendation. And I always talk about with families of connecting with teachers about creating a difficult day safety plan. So if you're having a really hard day on mom's birthday, maybe we could expect that could be a more challenging day. Or I often try to think about what things come up with school that we may not expect. So I think one example of, is it the week before Mother's Day and they're creating a Mother's Day craft, but the child does not have a mother? That might trigger a lot of intense emotions. And so how can we support that child in that moment? And I think the other thing that also often comes up in the school setting is sometimes peers, especially in this younger age, they don't know how to talk to kids about big things like grief. And so often what happens, and even adults do this, I should mention, we avoid people because it feels uncomfortable to talk about scary things. And what that says to the person is, these people don't care about me and don't understand what's going on in my life. And so I'm always really interested in helping, whether from a psychology perspective, can I connect with a teacher that they can talk with the classmates of what are some helpful things you can say to Joey when he comes back because his mom died, so that he can feel supported and not alone in his grief.
Yeah, that's a really good point, and something I hadn't actually thought of, that folks may avoid you because they're uncomfortable talking about it, but you could internalize that and think, oh, they don't like me. And so that's something for all of us to think about, as we avoid situations that are uncomfortable, that there's always second order effects to
Exactly.
that.
And nowadays, so many, because grief and loss is so pervasive, there's so many schools that offer grief support groups that come into the schools. I know a lot of, through different agencies, Ohio Health, they do some community grief, and they'll go into the school and do support groups. So that's another reason to really communicate with the school, because they might have wonderful opportunities like that for kids to connect with other kids.
Yeah, absolutely. So as we think about these younger school age kids, what are some ways that we can help them cope with this whole situation?
Well, just to piggyback what Ashley said about just the reassurance with these kiddos and the secure, loving environment that they're used to, that is huge. Another thing is consistent limit setting. I think sometimes we want to give these kids a pass on some of those things because they are struggling, going through this loss, but kids crave that. We all know that. And that structure and routine and those consistent limits, when they do this is the consequence. That's really helpful for kind of keeping things normal in the home environment. And the other thing I think is great is just to do fun things with your kid. Really, oh my gosh, my kid loves to do crafts. Let's do more crafts. Let's build Legos. Let's draw together. Just really honoring their time as being a kid and engaging in that those play opportunities with them. That really shows a child that you're there for them.
Yeah. And I would imagine that not only helps the child, it probably helps the parent too.
It does. It's a tangible thing you're doing with your child, connecting with them. And then certainly the opportunities for them to even have more feeling expression arise out of those opportunities.
Yeah, absolutely. Because when you're down on the floor doing something together, that's also a great time to talk.
It is.
Yeah.
It
So
is.
we're doing stuff with our hands, but
It doesn't feel
can
like we're
engaged.
Yes.
Yes. Yeah, absolutely. And then Ashley, as we build on this idea of legacy building for the person who has died, the young school age kids, what are some other things that they could get involved with?
Well, these are children who are going to have a memory of the deceased. So talking about the deceased, acknowledging that this Christmas is going to feel different because grandma or their sibling or someone isn't there, that birthdays are going to feel different. So acknowledging all of that and still talking about them are ways to build legacy. Also, visiting a site. If there's a burial site or a memorial site, visiting that, establishing a connection either through that physical site or through, a story or to a letter. Something that we recommend is books as well. There's a great book that we recommend called The Invisible String that has a workbook with it, and it has a lot of different ways to connect with the deceased and legacy and memory building around that. So if I were to recommend a workbook or book, definitely The Invisible String and the workbook that goes with that.
Yeah, great ideas. Let's move on to the 9 to 12-year-olds. So this is really kind of middle school at this point. So Megan, what does this age group think about and understand about death?
So at this age group, children will understand now that death is permanent, that it's irreversible, and that it's universal. And if you kind of think about that transition across developmental stages, these are really hard realizations to come up with, that when somebody dies, they don't come back, that we will all die at some point in our life, and that there's nothing that we can do to change an outcome. And so at this age, we'll also start to see kids ask more questions about maybe why the person died. So I know I was mentioning a little bit before, was it from illness? Was it a car accident? And so as these kids start to seek more of that concrete information, that concept of sense making or trying to make sense of what happened, how it happened, you might start to see more of those questions. And again, I think it goes back to what we've been emphasizing over and over again, that making room for these open and honest conversations is going to be especially important. And the questions that these kids ask will change as their cognitive ability to have these complex conversations changes. But I think we'll start to see more of that sense making at this age.
Yeah, absolutely. Do they still see themselves as invincible at this age?
So with school age, I think kind of depending on maturity, at the younger age a little bit, we could potentially see some of that. I think maybe in more of our 11 to 12, maybe not as much. But again, I think the maturity level, that can be very dependent.
Yeah. And when you said they want to know like why they die or how they died, it might, depending on the child, I mean, at that age, you might start to have kids who are interested in the body and how the body works. And they might have questions that you really don't know the answer to.
Yes.
But you could maybe help point them in the right direction to find those answers.
Yeah. When we think about sense making, I think there's a lot of different avenues we can talk about. So some kids do really well with the science part, right? So really talking about if it's an illness and getting into like how the body works and how it affects the body. Other families who might identify as more religious, they might take more of that avenue in helping make sense of a loved one's death. Sometimes we say there's no sense in it at all, right? Sometimes there's traumatic accidents where we can't make any sense of why this happened. And again, I think it's really helpful to model to kids, like we don't always know the answer why, and it's not fair, but helping them navigate those conversations, because for humans, when there's uncertainty and we don't understand things, that is really challenging. Yeah. So if we can help kids make sense of it, of course we want to, but also acknowledge if there is no making sense out of what happened.
Yeah, absolutely. And kind of letting them lead the conversation then again, because you don't necessarily want to go into existential dissertations on death with these kids unless they keep asking questions. And then maybe there'll be issues you haven't really thought about before, and kind of together you can tackle the topic, and that then builds bonds within the family.
Yes.
Yeah. And then Karen, what are some helpful words for the 9 to 12-year-olds, words and descriptions, and like how do we talk to this age group about death and dying?
I think simple and honest are two just really good rules of thumb for this. And I think Megan talked so much about how there's so many different levels. There's the spiritual level, there's the scientific and the body level, so that you might find your child really wanting to know the mechanics, like why why did their loved one not eat for a lot of time, before they were dying? Why were they sleeping so much? That kind of stuff. And so that might give you an opportunity to just say, as this person was dying, their body was shutting down and they didn't need as much food and they were tired and things like that. So you can really incorporate some of that education into it, but just keep it simple. And you can just, again, provide that reassurance that that you are there for them and that you will always miss this person, and just really incorporate that into the conversation. And they lead you where they want to go. Like Ashley said before, they might get that information and be okay with it, and another person might ask, well, why? Well, why?
Yeah.
And so it's good to always discuss it too with other people in the family, how you want to present that.
Yeah.
And to incorporate family values to anything.
Yeah, that makes sense. As these kids are getting older now, and we're now in middle school, it seems that as they think about things, like and maybe I'm completely wrong about this, not being a psychologist, but it seems that as you get a little older, it's a little bit more difficult to put things aside and move on. And so you still think about it, and then you may still keep asking questions about it. So, it may be 3 or 4 months after someone has passed away that you're still bringing it up, which then could bring up feelings of sadness in the parent. And I could see that becoming a dynamic in the family where maybe the mom and dad doesn't want to talk about it anymore, and the child still wants to talk about it. Like, from a parent standpoint, how do you engage with your child on a topic that is still painful for you?
Well, I think, like we've talked about before, the normalization is so big, because I think they might be able to express, oh my gosh, I feel really sad about this, but brother Joey seems to not be worried at all about it. So just that normalization, and then also being honest with your child about how you're feeling, and really encourage them to come forth, even if it might make you cry as a parent. It's okay. And verbalize that. I'm feeling sad sometimes when we talk about this, but I also have these happy memories, and just really incorporate that. And it is okay if you're having a rough moment. You can say, I'm going to have you talk to dad about this right now too, and maybe see how he's feeling.
Yeah,
and that might be a way of deflecting, and maybe you're able to just kind of think and process more and then go back to it. But as Ashley says, we tell our kids all the time, it's okay to feel bad. It's okay to feel mad, glad, all that kind of thing. And so it's okay for us to emulate that to them.
Yeah. And that's actually healthy for them to see us experience all those emotions as well. Very good.
And I think at that moment, if families, parents, or caregivers are talking about difficulties connecting with their kids or having those conversations, it's also okay to acknowledge that. And that might be a perfect opportunity to then pull someone in who's unbiased, like a grief counselor or a guidance counselor at a school. And that's totally okay as well. Sometimes when the whole system is grieving and everybody's grieving in very different ways, it becomes very, very messy. And so it's okay to find those alternative options to kind of seek counseling and support. And then once you're able to kind of build your own coping strategies, coming back together as a family to cope together and learn ways to support grieving within that system.
Yeah. How do you know when you do need to get professional help? When does sort of the normal grief process become, oh, we need to get some extra outside help for this? How do you know?
That's a great question that we get all the time. So I'm glad that you're bringing it up. I think, as Karen mentioned before, the greatest resources are usually in the home. And so oftentimes our initial response as psychologists is to equip parents with the tools that they can best help support their children with grief. When we start becoming more concerned, it's more of that idea about interference with functioning. So again, as we said, it's normal to experience all of these emotions. It's normal for you to grieve for the rest of your life. And it looks different through stages, but to have those emotions come up and for it to feel just as painful on some days, that's normal. But when it starts to interfere where the child can't get out of bed, or maybe they're not going to school, or they quit playing sports, or their grades have significantly dropped, or even like the acceptance of death, sometimes kids will always be in that denial denial phase and they wake up and they're like, where's dad? And those are the things that you can think about really interfere with quality of life. And that's when we become more concerned. And we actually call that prolonged grief. So just most recently, we've given that a little bit of a different name. And there is a lot of balance where some people are unsure whether that pathologizes grief. But I think what they're really trying to do by putting a word on that is this is when it may be more important to seek extra counseling because it's really getting in the way of day-to-day activities.
So it really comes down to quality of life. Although in the immediate stage after there's a traumatic event like this, we can expect there to be a problem with quality of life. But when we get out a few months, really, we should still be able to go to our jobs, go to school, function as a family unit, and kind of get back to some sense of normal. And if that's not happening, then we want to get some help.
Yes.
Yeah. And then Ashley, so in this 9 to 12-year-old range, what kind of behaviors in response to death and dying and impacting the family, what can we expect behavioral-wise out of these kids?
Well, we've touched on some of this already, right? We've talked about, the behavioral reactions and responses of being sad, having tummy aches, things like that. I think it's something to recognize in this age group is their understanding of death is changing. They're understanding the finality of death. So whereas your younger school age child may, be coloring and say, oh, sister died. Yeah, sister died. And they're back to coloring. This age group isn't quite as fleeting with that thought, right? I mean, they're going to be thinking about that more. And they're going to be thinking, think about how us as adults cope with something. We're distracted. We're forgetful. We're maybe not performing as well in school or work. And so I think that we as adults recognize that for ourselves. And so we need to think about how that applies to a child. And so I think we're going to see those same exact behaviors in this age group as they, with their deeper understanding of death, they're going to have that deeper, longer, more prolonged reaction than the younger school age children. Yeah,
absolutely. And then Megan, how can we best help these kids cope? I imagine now some things like anxiety and depression, and I mean, these can really start to manifest long term, right? How can we help maybe prevent some of that from happening to begin with?
Yes. One thing that I start talking about with kids at this age with grief is that grief is felt in both your heart and body. And I think that allows us to really open up what that box of coping strategies can really look like for kids. So one big coping strategy that I think can be helpful is that physical outlet, right? We have a lot of energy. And so finding ways, are they going to go ride their bike or take walks or play kickball, ways to get that physical energy out. But then on the flip side, when we're thinking about emotionally and helping calm down that physiological response from your body, maybe it's practicing things like regulated breathing or muscle relaxation exercises, all the types of strategies that we would often talk with kids about when they are experiencing more worries or sad mood. But I think really normalizing that for kids can help. And then again, going back to school, I think, again, we're always trying to find which systems schools are involved in. And so are we connecting kids to extracurricular activities or making sure that they have time for friends, because we're also really trying to promote normalcy and socialization within their environment, because that is very beneficial for them as well. And then, as we just mentioned before, if we start seeing that significant interference in functioning, then we might recommend having them learn additional coping strategies with a counselor.
Absolutely. Karen, what then are some legacy building ideas for the middle school grades?
Well, we've mentioned a lot about the memory boxes. I think about at this age taking it a step further and, of course, gathering all those special things. But then maybe, do you want to write letters to your loved ones? Do you want to journal? Do you want to do photo montages? Things like that. Really encourage them to come up with their own ways of honoring that person. I mean, nowadays kids do amazing things. They start, help start foundations and start raising money in honor of people. I mean, it's just amazing what they can do. So kind of capitalize on their creativity and let them lead you. We've had several families do things like memory gardens, planting a tree, that kind of thing. We have some people that love chickens, and the way in honoring that, I mean, the possibilities are really endless, but encourage them to lead you.
Yeah, that's a great advice for sure. And I love the memory garden and planting a tree, because especially if maybe the place that your loved one is buried, might be far away and not easy to get to. So it would be more convenient that there's this physical place that you can go and talk about this person and remember them. And, planting a tree is one way to do that. Ashley, let's move on to teenagers. So what do teenagers think about death? And there's still that invincibility.
Well, yeah,
piece,
certainly.
right?
Certainly. We know, yes, our teenagers' brains are not fully formed, and they do think of themselves as quite invincible. But I will say, too, we've had the very humbling privilege of working with teens who themselves are dying, or teenage siblings of children who are dying. And I will say it's humbling, because I'm always still impressed by how this age group does understand death. And so what I would share with parents and caregivers who are parenting teenagers who are navigating death, grief, and loss is that they know more probably than they think you do. You think they do, and they might teach you something about the death, dying, and grieving process. Absolutely. So certainly this age group, they understand death, they understand the finality of death, and us as caregivers being able to keep those communication lines open will help them cope and navigate those really strong feelings.
Yeah. Megan, what advice do you have as we're talking with teenagers about death and dying? Do we do it just like they're another adult, or is there some modification that we make?
Yes. So I think we're going to start having more complex conversations, which we were hinting at in the last developmental stage. One thing that I think is new to add to adolescence is really this idea of providing more education about what grief looks like, because developmentally, again, they are more advanced. And so one thing I often talk about with parents in terms of supporting teenagers who are grieving is this idea that grief is not meant to be fixed. It's only to be carried. And what that really means is that idea of, oftentimes for parents, we want to take away pain from our kids, right? We see them hurting and we want to say, it's going to be okay, which is meant to be a supportive statement, but oftentimes that can sometimes feel invalidating, and then the teenagers feel guilty for having this variety of emotions. And so I think a big recommendation we talk about with caregivers is using that emotion-focused language, that it's okay to feel sad, it's okay to feel angry. Sometimes teenagers will also talk about feeling guilt if they have feelings of happiness because they feel like their dad just died. They shouldn't be able to go out and enjoy their basketball game. And so it's really important to facilitate these types of conversations. There's all types of myths of grief that complicate our coping with grief. So that grief is on a timeline, that it goes in certain stages, that there's a right way to grieve, right? So these are all things that we want to start including in our conversations with teenagers to help them normalize their experience, but also to help them feel more comfortable with what this experience is going to look like. And then the other thing that I often talk about with teenagers, or encourage parents to really talk about, is that grief is a sign of love. And there is one quote I always like to use with teenagers that I think can be really helpful when we think about their coping. And it's the idea that grief ebbs and flows over time. It's a constant dance of sorrow and joy, pain and love, but that grief lasts as long as love does, forever. And so again, I think it really normalizes that timeline, and it changes from time of death until, throughout time, but that this allows them to know that it's going to ebb and flow over time, but it's truly a sign that they loved the person in their life.
Yeah, that's really beautiful. And I think anticipating that this is going to be sort of a lifelong process really can be helpful, so that then teenagers aren't surprised when they have those feelings again months or years down the road. Mm-hmm. Yep. And then, Karen, what can we expect behavior-wise out of our teenagers in response to death and dying?
That's a good question, across the board for all teens. But I think it's important to keep in mind that kids at this age, they just want to fit in. They just want to belong, and they don't want to stick out. So they're going to try to do whatever they can to kind of just fit right in. And they might not want to talk about the death with their friends, and then just kind of keep things as normal as possible. They also might be more susceptible to some more complications in their grief and some unresolved grief, things triggering something else. So that's always good to keep in mind. Some of them are just want to kind of remain in denial. they know what's going on. We know they know, but it's just easier to kind of put it in that space just so they can, like I said, just go on being a normal teen. Some take on more even adult roles though too, and try to help fix and want to try to be, especially if a parent is really overly, they might be struggling with their own grief. So that adolescent might want to kind of come and help be some of the parental role and be guiding other people in the family. Other normal.
And that can be healthy?
Yes. Yeah. You just need to, it's just a balance with everything. I mean, some of that is just being responsible and being, in touch with the family system, but you don't want them to have too much of that on them too, because they, you want them to fit in and be teens. Also, anger, irritability, aggression even. Again, some of this is just normal developmental stage with them, but it just might be more elevated or heightened at this stage. They also want to... sometimes relationships in the family are affected. I think, if you think about adolescence, it's the height of separation and individuation. Who am I apart from you? So this might add a whole different layer within the family system if you tag on the grief with it. Also, we've talked a lot about the somatic complaints, the physical complaints. Your teen might be the one that you might get a text when they're not supposed to text in school saying, I'm going to the nurse's office, for a headache, a stomach ache, that kind of thing. Yeah. So just being able to talk through that, just changes in sleep, changes in appetite, challenging their parents more, being more defiant. Again, it's hard to sometimes navigate whether this is normal adolescent behavior or it's just a change. Yeah. The other thing is they do a lot of use the same coping mechanisms they used before. So I think sometimes people think, oh my gosh, death changes you. But a lot of times you just kind of revert to what you did before. So if you were somebody that was open and expressive, you might continue to be. So we think of all these changes that they have, but they might just be coping the way they did prior to the death.
So, and if they have underlying issues that have been there before, whether it be they struggle with anxiety, depression, with maybe school and attention and all of those things, it's just going to be magnified.
Exacerbated. Yes.
And so expect that.
Yes. And concentration focus is huge. So obviously school work might be affected by that. Yeah.
And again, getting the school involved and letting them know what's going on in your teenager's life is going to be an important thing.
Yes. Go to your conferences, and really communicate. Yeah.
Ashley, are there other ways that we can help our teenagers cope with these situations?
Yeah. This is an age modeling is going to be really important too, right? So for parents or caregivers in the home, modeling, navigating tough emotions is a great way to help kids cope. And if you need to phone a friend or phone in another relative or your community or the school or whoever, you use this. Use your natural resources to help you as you navigate your own grief, but navigate really hard questions from teenagers, right? I mean, teenagers, they have tough questions. They are looking for validation. They're looking for meaning in the world. I mean, some of it is just that, exactly what Karen said. They're establishing their own individuality, right? So they're going to have tough questions, and that's totally normal. And being able to validate that this sucks, validate that this is painful and this is unfair, I think goes a long way as well with teenagers, because they may not be quite as satisfied with those, what we talked about in earlier age groups, the shorter answers, just answering, the simple question. They're going to want to go deeper. And I think that's totally normal to acknowledge and validate that.
We talked about the younger kids, like, can they go to a funeral? At the teenage years, maybe they're involved in planning the funeral, especially if it's an immediate family member.
Absolutely. They may be involved in we'll talk about, legacy building, but they may be involved in memorial planning. They're going to have probably had a deeper connection with this person because they've known them for longer. So yeah, including them in as much as you can and as much as they want to be included absolutely would help with coping.
Yep. And then, Megan, what are some legacy building ideas during the teenage years? I'm sure all the things that we've talked about so far come into play, but is there any more advanced things that these kids can do?
Yeah, one thing that I think is unique about this developmental stage is they're really coming into themselves, right? They're looking at their goals and future careers, dreams, those types of things where I think legacy can really be built off of that. So I work in pediatric oncology, and I've always been very interested in how these teenage siblings have made meaning out of a brother or sister's death from cancer. So as Karen had mentioned, maybe they start a foundation. Maybe they go to college and major in biology and want to go to medical school to be a neurosurgeon because their sister died of a brain tumor. Or if you even think about as they start to think of what their goals are in the future, maybe when they become a father, they become the father that their father was to them, right? Like ways that they continue to carry on that memory through the roles that they'll play as they try to start to find ways that they're going to go about their future. And so I think it's just really amazing as they get older, the ways that they find ways to incorporate that legacy in their next steps of life as they make it on their own.
Yeah, absolutely. And those same ideas of planting gardens and scrapbooking and memory boxes and all of those things are still going to come into play.
Yes.
Yeah, absolutely. Karen, I'm going to put you on the spot, and I apologize because we didn't talk about this ahead of time. But I did want to talk a little bit about hospice and palliative care,
Sure.
And what you guys do in the home-based program here at Nationwide Children's.
So Ashley and I are the social worker part of the program, but we have nurses that go into the home. Social work, we have chaplain support, we have certified child life specialists, we have music, and we have massage. And also our physicians are able to play a role outside of the home, but can also make home visits. So we really are active in their lives. On hospice, nurses need to visit within the home every 2 weeks, but we have a lot of home-based palliative kids that we have for long periods of time, and they just have to go every 60 days. But then as far as the other disciplines, we try to go as much or as little as the family wants, and families really appreciate the whole team approach. I mean, our massage therapists are wonderful. Music therapists, they do things like heartbeat recordings. They help some of our teens write songs. They do legacy building themselves, and then their siblings are involved with child life if they would like, and do a lot of that memory making and those kind of meaning making kind of things. So it's a really comprehensive team that is in the home and really helps support the patient, their siblings, their parents, and their extended family.
Yeah, we our role is really as much as we can to reduce any suffering that we can. This is the hardest part of their child's journey. And what we can try to do as a team is just be there and give them the honor of the best death that we can. Yeah. So most of our patients do die in the home, and they are well supported by our team of, like Karen said, nurses, physicians, social workers, our chaplain, child life, music, and massage to do what we can to just honor and help them with this tough part of their journey.
Great. And I'm going to put you, Ashley, on the spot as well. Sorry. Okay. What kind of training do you need to be a social worker, in particular that deals with grief and death and dying? I mean, we may have teenagers out there listening to this podcast right now who think, hey, this sounds like an interesting career.
Yeah. Well, Karen and I both have our master's degree in social work, which is required to do direct social work care here at Children's. We both have participated post-graduation in trainings related to grief, death, and dying. Actually, we're going to one tomorrow. We're going to be in an all-day conference tomorrow. So really identifying different trainings or specialties that are out there, if that's that's your tract, then to look for those and specifically take an interest in that.
Yeah. Is social work, and forgive me for really not understanding this quite as well as I probably should.
No, that's okay.
That's an undergraduate degree, and then you go on to get your master's, or or is there undergrad something else, and then you become a social worker through the master's program?
No, there is both a bachelor's program of social work and a master's program of social work, and then we are licensed at both of those levels. So you take your boards after your bachelor's degree, and then also again at your master's degree. Master's level can open up their private practice if they want to. They can do independent counseling if they want to at that master's level.
Gotcha. Okay.
And we both have supervision as part of our independent license too, which is just some extra training with that.
Yeah. So, but it's always going to be at least a master's program for social worker. Can you be a social worker with just a bachelor's degree?
You absolutely can be a social worker with a bachelor's degree. And there are many, many, many qualified social workers with a bachelor's degree. Many of our social work colleagues that are in Partners for Kids, many of our social work colleagues that work in foster care or child protection agencies are all bachelor's level trained, very capable, capable of doing the social work there. But there are, what sets it sort of a little bit aside is that we're state certified. So whether you're a bachelor's level or a master's level, you have taken a board from the state that says that you are licensed to practice social work.
Gotcha.
I wanted to add something that is wonderful about our hospice and home-based palliative programs is that Ashley and I continue to follow the families in bereavement for 2 years after. Wow. Yeah. So that is really nice because we are the same social workers that have been in the home during the whole process, and then we already have that relationship. We knew the child, and then we have the relationship with the family, and then we can continue to follow. So that offers great continuity of care.
Yeah. Great to know. And then Megan, in terms of psychology and being a psychologist that helps folks and families with death and dying, I know we've talked about this on the program before, that from the psychology standpoint, you can have a PhD or a PsyD. Mm-hmm. What are the difference between those two? And then how does someone get involved with helping those impacted by death and dying?
Yeah, I would say the big difference between the PhD and the PsyD is the PhD has a little bit bigger focus on research. So sometimes PsyDs also have the dissertation process, but not always. So there is a bigger focus on the research domain. But we here across Nationwide, we have lots of PhDs and PsyDs, and it's been a really nice collaboration within our department. In terms of getting more experience as a psychologist in the world of death and dying, I think this often happens in your internship and fellowship years, depending on where you specialize. So we are classified here as pediatric psychologists. And so for those of us in oncology or bone marrow transplant, cardiology, NICU, we're naturally being exposed to those types of populations who are likely going to experience death. On the flip side, though, death happens universally across all of this, right? So even child clinical psychologists are going to have kids that come in whose grandparents died or parents died unexpectedly. So it really is a big topic for all of us. And I think if we just think about society in general, death is uncomfortable. And so I'm always trying to find ways to provide education and get people feeling more comfortable about having these conversations, because in graduate school, it's usually like one lecture on grief. And that's really all we talk about it. There's not a lot of specialized training opportunities within the psychology world. And so I think ways that we can expand that educational opportunity is helpful for all of us to get comfortable with the uncomfortable.
Yeah, absolutely. We're going to have several links for folks at the on the show notes page over at PediaCast.org. We'll put a link to social work at Nationwide Children's Hospital, psychology, palliative care, hospice, all of those things. So if anybody's interested in learning more about those programs, you can find that easily. We'll also have a link to a grief and bereavement information page that has lots of great content that you can look through or share amongst yourselves. So once again, Karen Roberts and Ashley Pelino with clinical social work at Nationwide Children's Hospital, and Dr. Megan Schaefer with psychology. Thanks to all of you for stopping by and visiting with us today.
Thanks so much for joining.
Yeah, thanks for having us. This is, it's really a tough topic, but very, very important. So thank you.
Thank you. It was such a pleasure talking with you all today.
We are back with just enough time to say thanks once again to all of you for taking time out of your day and making PediaCast a part of it. Really do appreciate that. Also, thanks to our guests this week, Karen Roberts and Ashley Pelino with clinical social work and Dr. Megan Schaefer with psychology at Nationwide Children's Hospital. Don't forget, you can find us wherever podcasts are found. We're in the Apple and Google podcast apps, iHeartRadio, Spotify, SoundCloud, Amazon Music, and most other podcast apps for iOS and Android. Our landing site is PediaCast.org. You'll find our entire archive of past programs there, along with show notes for each of the episodes, our terms of use agreement, and that handy contact page if you would like to suggest a future topic for the show. Reviews are helpful wherever you get your podcasts. We always appreciate when you share your thoughts about the show. And we love connecting with you on social media. You'll find us on Facebook, Twitter, LinkedIn, and Instagram. Simply search for PediaCast. Also, don't forget we have another podcast called PediaCast CME. That stands for Continuing Medical Education. Similar to this program, we turn the science up a couple notches and offer free continuing medical education credit for those who listen. It's Category 1 credit, not only for doctors, but also for nurse practitioners, physician assistants, nurses, pharmacists, psychologists, social workers, and dentists. And since Nationwide Children's is jointly accredited by many professional organizations, it's likely we offer the exact credits you need to fulfill your state's continuing medical education requirements. Of course, you want to be sure the content of the episode matches your scope of practice. Shows and details are available at the landing site for that program, PediaCastCME.org. You can also listen wherever podcasts are found. Simply search for PediaCast CME. Thanks again for stopping by, and until next time, this is Dr. Mike saying stay safe, stay healthy, and stay involved with your kids. So long, everybody.
This program is a production of Nationwide Children's. Thanks for listening. We'll see you next time on PediaCast.